Well, my biggest piece of advice is to start with lifestyle, understanding what you can do from a lifestyle approach. Everything else will come in turn. If foundational, I always say, if you're going to have a 1,000-piece puzzle, the 600, you always start with the rim, right? You always start with the frame, the
Exactly.
straight edge. So the 600 surrounding pieces of this 1,000-piece puzzle are lifestyle. And then the center is pharmaceuticals and hormones and these other things. But you got to start with the outside. So master lifestyle medicine issues. And then take courses in functional medicine, which should be just called medicine. Because if you don't know how,
Yeah.
if you don't get a basic idea of cell processes, of pathways, of interactions between organ systems and so on, like just foundational, how do mitochondria work and the basics of cellular processes and pathways and enzymes, then you will just be a pawn of big pharma, just like
Robot.
this symptom, this drug.
You're listening to the Lifestyle Medicine Podcast with Dr. Ivan Rusilko, brought to you by Access Lab, where we explore new perspectives at the forefront of personalized healthcare.
Hi, how's it going? My name is Dr. Ivan Rusilko. I'm the host of the Lifestyle Medicine Podcast, brought to you by Access Medical Labs, and I have got a treat for you today. I have Dr. Gersh with us, who is one of the leaders when it comes to everything female hormones, PCOS, you name it. She is a leader in everything, and I think she's probably populated half of South California out there. She is a legend, I got to say. She has a book out. It's PCOS SOS. It's a gynecologist lifeline to naturally restore your rhythms, your hormones, and most importantly, your happiness. Dr. Gersh, it's an absolute pleasure to have you on the podcast. Thank you for stopping by.
Well, it's my pleasure to join you and to talk about anything that has to do with female health.
See, I love that. When you're so good, you can talk about anything. But today, it's unique. I think I would like to talk to you about something I think it's 1 out of 10 women suffer from, which is PCOS.
Sure, that we think it's higher than that. In fact, it may be at least 25%. It's comes in a spectrum. So, everyone is not the same severity, but it is hugely common. It is the most common endocrine disorder of women, the most common problem in terms of infertility. So yes, it's a massive problem.
No, for sure, for sure. And so, in your practice, out of everybody that you actually have come through the door, are you diagnosing most of these people based on symptom alone, or are you actually going into the actual lab testing with them?
Well, PCOS, which stands for polycystic ovary syndrome, and the name may actually be changing. I mean, there's a whole movement to change the name to make it more in alignment with what's really going on, which is involving a lot more than the appearance of the ovaries. But this name is going to stick. I know how it works in medicine. Even if you come up with a new name, the old name just drags on with the new. But basically, the main takeaway that it does involve lab testing is that PCOS is a diagnosis of exclusion. You have to make sure it's not something else. Another type of androgen excess disorder. Androgens are like the male type hormones. There's a variety of other causations that can give you very similar clinical presentations to what happens in PCOS, which of course we can talk about, like, what does it look like? What's going
Mhm.
on? But you have to exclude these other conditions to then leave with the diagnosis of you have PCOS. So no matter, most of the patients who come in with PCOS that I see have already been diagnosed from somebody else, by somebody else, and they're looking for better treatment. They're saying, like, what the heck is happening? And I'm not getting where I want to go, but they've been given that label. Sometimes it's accurate and sometimes it's inaccurate. I always start from scratch and really make sure that the diagnosis is actually even accurate to begin with.
So, what are some of the most common symptoms that a patient with something such as PCOS would actually exhibit? And, I can kind of explain what are the most, like, I would say, top 3 things that, okay, you might have PCOS if.
Okay, well, the top 3 things is you're actually supposed to have 2 of them, okay, at least,
Okay.
or all 3 is the most common. That would be some type of irregular cycle. So it could be that you have too much bleeding or too little bleeding, like maybe you go months and months without a menstrual period. So irregular cycles, that's like classic. The other is androgen excess. Now, the androgen that should be in excess to be PCOS is testosterone, which is produced by the ovary and the adrenal gland. But this would be testosterone primarily from the ovary, which the only way that you can really know that is by looking at what's going on in the adrenal separately. But so it's testosterone excess, which will then give you all the manifestations of androgen excess, which would be cystic and often recalcitrant, really hard to treat acne, where you get these big cysts, the
Okay.
deep ones, they're painful and they are scarring. They will often give you scars over the lower part of the face, but it could even go elsewhere. It could be on the chest, it can be on the back. So it's like really miserable. Excessive body hair, predominantly hirsutism on the face. So, women will often have like a beard type of thing. Now, if it's like a true extreme beard, then it's usually a different form of androgen excess to be that extreme. But it can actually be pretty moderately bad. I mean, that you can see 5 o'clock stubble, and they go and do different kinds of hair removal techniques. It could be waxing, it could be threading, it could be lasering, or it could be like shaving twice a day. So there's like a variety of things to deal with this because it's such a drag on a woman to have these masculine type features. This is not the epitome of wanting to feel feminine and good in your own body. And then there's androgenic alopecia. That's the hair thinning version in women that is sort of the female version of male pattern baldness, where they get really hair thinning. So it's what happens in androgenic alopecia is the hair goes through natural cycles. It grows, it rests, it falls out. And when you have too much androgen, the cycle shortens. So they have a shorter growing phase, and then it goes into the resting and then inevitably to falling out phase. And each time the hair falls out, the follicle that the hair grew in before, it
Mhm.
actually gets smaller. So it's miniaturization of the hair follicle. So the hair over time gets finer. So you have less volume. Each hair is thinner, it's less volume. So it looks like you have less hair on your head because the volume is so much less for each hair. But eventually, the hair follicle actually closes completely, and then no hair will ever grow from that follicle. So over time, the hair becomes finer, thinner, like wispier, and then less, just less coming out of the hair follicles. Also, a real ego buster, for
Yep.
women. So that's the androgen excess. And then the third one is one or both of the following, which is on an ultrasound of the ovaries, they have the signature polycystic ovaries, which would be, and you never see the radiologist count it, but it should be at least 20 of these tiny little follicular cysts. They're little tiny
Okay.
circles with fluid, and they are around the rim or what we call the cortex of the ovary. So that's why it's been called a string of pearls. It kind of looks like little circles all the way around, like a little like necklace of pearls. And it should be at least on one ovary that you have at least 20 of these little tiny follicular cysts. And then a new criteria that fit in is an elevated hormone called anti-Mullerian hormone, a
Okay.
blood test, right?
Yep.
So you want to get that on adults. By adult, I mean at least 18 years of age because it's not a reliable test in younger kids. Okay. So the
Mhm.
criteria for diagnosing PCOS in a young teen is not as simple in a way.
Yeah.
It's more complex because a lot of young teens will have acne and they'll have some elevated androgens. So it's a little iffy to diagnose before the age of 18. It's more like you would say PCOS trending, than a
Gotcha.
definitive diagnosis in someone who's like 15. But, that doesn't mean you can't do stuff and know what's going on with the hormones. Because once again, you want to rule out that they have one of the other conditions that can give androgen excess. So basically, that's like the criteria for making the diagnosis. And those are like just the basics. That
The base.
isn't getting into the metabolic dysregulation that accompanies PCOS. And
I
this
was
is like,
super curious to hear about this aspect of it as well when it comes to like, how people feel, the overall aspect of, what this does in the overall, the metabolism in the system as a whole. So I
yeah.
I mean, if you could please dive into that.
Absolutely, because until relatively recently, and this is part of the reason why there's a group that wants to change the name to be more telling of the metabolic dysregulation that's accompanying PCOS. So for years and years, and most of the research was done in terms of fertility related issues. That was the main one because
Mhm.
women with PCOS do have very high rates of infertility. They also have high rates of pregnancy complications like gestational diabetes, preeclampsia, gestational hypertension, higher rates of miscarriage,
That's
premature
goodness.
deliveries, and so on. So, most of the research was involved in those areas. But when you understand the underlying mechanism of PCOS, which is in the ovary, you have this process where you convert testosterone, which is made in a certain group of cells in the ovary,
Mhm.
and that's where all estradiol, the estrogen that comes from the ovary, is called estradiol. Estrogen, and that's where measuring hormone levels comes in.
Yep.
Estrogen is a family of hormones. It's not a hormone, just like B vitamins. It's like you have a deficiency of B vitamin. Then you say, what? Like
Which
B12 is
one?
not the same as B1. Exactly. And just
Exactly.
like B vitamins, it has a letter, in this case, a big E, and a
Mhm.
number 1, 2, 3, or 4. And the estrogen made by the ovaries is called E2 estradiol. And that is made 100% from testosterone. No estradiol exists in the human body that isn't derived from testosterone, and no estrogen is in the human body that isn't derived from an androgen of some kind.
Mhm.
So in the male hormone family, because there are other androgens like DHEAS, DHEA. A DHEAS always has to be measured. We'll talk about that
Of
because
course.
these are part of the rule outs and to see what's going on, looking at the adrenal as another source of androgens. But if we look at the ovary has special cells that make testosterone. And then the testosterone moves down the line, the assembly line, to the next group of cells, the granulosa cells, where they are then working to convert the testosterone into estradiol. Now, all of this relates to the hormones that are coming from the pituitary gland, which you
Mhm.
also need to measure,
Of
the
course.
luteinizing hormone, LH. All of this is under the control of the brain, the
Of
hypothalamus of the
course.
brain, which puts out little signaling factors to the pituitary gland, also called like the master gland. And then the pituitary gland, under the direction of the brain, puts out luteinizing hormone. That's the hormone that tells the ovary to make testosterone. And
Mhm.
then FSH, follicle stimulating hormone, that's the hormone made by the pituitary gland to tell the ovary to make to make the estradiol from the testosterone. But in the ovaries of women with PCOS, there is too little FSH that's being made in the pituitary, and the ovary is not, and we don't even know why that is, but we know the ovary doesn't make the enzyme aromatase that converts the
Mhm.
testosterone
That's what estrogen.
into estradiol. So basically, you have a situation where the brain, which has sensors to estrogen, but not to testosterone, the brain does not control the testosterone based on the level of testosterone. It controls the testosterone based on, and for the ovary, based on the level of the estrogen. Okay. So we don't have sensors in the brain for testosterone, just estrogen. So
That's
if you're
probably a good
not
thing for you
making,
ladies.
yeah, right, because we would always be then men, right? So then if the ovaries are making too little estrogen, which is what happens in women with PCOS, because the enzyme under the direction of follicle stimulating hormone isn't producing the proper effect of converting testosterone effectively and efficiently into estradiol, the brain says, "Oh no, we don't have enough estradiol." So it tells the pituitary, put out more LH, more luteinizing hormone, please.
Mhm.
And then the ovary will respond because the ovary is really good. It's a different skill set to make testosterone than to
Uh-huh.
convert testosterone to estradiol. The skill set to make testosterone is like top of the line. So the luteinizing hormone goes higher and higher, and the testosterone production from the ovary gets higher and higher for the purpose of making more estradiol. But because you
Yeah,
have
right.
this like little defect, you can't convert properly the testosterone into the estradiol. So you effectively have too little estradiol. Now, that's why in terms of doing lab testing, you wanna always measure your LH and your FSH, and you look at the ratio. The classic ratio is really high LH to low FSH, at least usually 3 times the amount of LH, luteinizing hormone, to follicle stimulating hormone, FSH. Normally, the ratio, except for the day prior, like, to ovulation, the ratio is normally 1 to 1, not 3 to 1. So that's another tip off that you have a problem with overproduction of testosterone and underproduction of estradiol. Now,
Now, does
what
it
does
matter
this
when you test? I mean, like for you, like when you're testing this, is it luteal phase, follicular phase, mid cycle, or does it
well,
doesn't
the
matter?
thing with women with PCOS is there often isn't no phase, because their cycles are so irregular that we often really don't have a choice. But
Okay,
if we did have a choice, then I would probably usually get it mid-luteal phase.
mid
Okay, and
luteal.
then at the same time, I would get an estradiol level and I would get a progesterone level if you actually had that phase. But, often we never know where they are in the phase, so we just get it, and it
Yep.
typically will be a high ratio like whenever you get it because you make estradiol for the whole cycle. But
Hmm.
it's really, you can't always time it because we don't have a cycle typically. But
Hmm.
what happens, and this is like a really key part of the metabolic problems, getting back to like what is going on metabolically
Yep.
speaking. Estradiol is the master of metabolic homeostasis. So if we talk about like what the heck is metabolism anyway? It's the production, storage, utilization, distribution of energy, which is a
ATP.
critical issue. And energy is the spark of life. If you have no energy, you're not alive. It's like if you think of electrical energy, you think of well, the heart, you do an EKG. If your
Hmm.
heart has no energy, that's flatlining, right? That's
You
like,
have no E.
uh-oh, we know it that we've all seen that on TV, right? For
Very
flat.
true.
The same thing for the brain, then you call it brain death. This is
Hmm.
like when you don't have enough energy. We have to have energy. And estradiol is the master of creating energy. It's the master of functional mitochondria, fat tissue, like all the different organ systems. There are receptors for estradiol, and we'll leave progesterone out for this story just because it's important too. It's like we don't want to underestimate it. But if we were going to use an analogy, and I have to come up with a female version of this, maybe you'll come up with something and get back to me. It would be like Batman and Robin. Like they're a team, but if you're going to have a hierarchy, Batman is like above Robin. Um, but
I love
so
that.
progesterone is a little below estradiol, but they're both
Okay,
a
okay, I
team.
got you.
They're both important. Like without, Robin, Batman can be in pretty big trouble. So we need both. But in terms of like, there are receptors in every organ for estradiol because in terms, and this is really simple to when you really think about this. I figured this out when I was doing thousands of deliveries that whether we want to have babies or not is personal choice as far as I'm concerned. And
Hmm.
recognizing that only humans are the species on planet Earth that tries to control their reproductive destiny. Like if you have a bunch of dogs, they don't think, I don't think this is a good year to make
Not
puppies.
this
They
month.
do, no, they don't even think about it, not even a little bit. So, that's not, built into nature, but only
Hmm.
humans do. But when we get over that part, the prime directive of life is the creation of new life. And to
Exactly.
that end, you need to have a healthy, for the female part, you need to have a healthy woman. And pregnancy is now recognized as the ultimate stress test of a reproductive age woman. Like, oh my gosh, if you fail pregnancy, like you have a pregnancy related complication, we now know that bodes poorly for what's
Yep.
going to happen when you go through menopause because you're already on sort of metabolic ice here, thin ice here that
Yeah.
and then you didn't, you pregnancy tests your metabolic functionality. And
Hmm.
the thing is that in order to be healthy, to be fertile, to get through pregnancy, and then raise your children to their sexual maturity and do it multiple times over, you really need a healthy cardiovascular system. Like in pregnancy, women have more than 50% the blood volume to pump around. So you need to have a really robust, healthy cardiovascular system, mitochondria. You need to have a really functional immune system that's like amazing, that it doesn't kill the fetus, but yet it keeps the woman alive. I mean, we have a different immune system than men. Women have more white blood cells, they make more antibodies. That's why 80% of autoimmune diseases occur in women, because when
Yep.
things go wrong, they go wrong in a bigger
Go
way.
really wrong. Yeah.
Yeah, they go big wrong, right? So we have to have this incredible immune system. We have to have, of course, a functional uh, cardiovascular system. We have to have musculoskeletal, genitourinary, neurological system. And all of those systems rely on estradiol. In fact, the master clock that sits atop the optic nerve that creates our time clock for the
Yep.
circadian rhythm is completely dependent on estradiol. That's why in menopause, and this has been shown in women with PCOS who are more like perimenopause, they don't have enough estradiol, but they still have estradiol, totally different underlying causation, but similar effect. Not
Yep.
enough estradiol. They live in a body that is perpetually jet lagged. In fact, there are even studies showing flipping, and this can be tested, flipping their circadian rhythm, where instead of having high cortisol in the morning and low at night, they have
They
low
flip.
in the morning and high at night. So at night, they suddenly get an appetite.
Burst of it.
They're
Yeah.
feeling more awake. They say, I'm a night owl. No, your circadian rhythm dysfunctional, but
Yeah. Oh, for
it's
sure.
like, and you can, of course, measure cortisol levels. And
Mhm.
that is another thing that happens. So they have essentially the equivalency of jet lag. They have circadian rhythm dysfunction. And when you don't have enough estradiol, you don't make energy well, your mitochondria don't work properly, your vascular system is not healthy, you don't make this really important gas called nitric oxide that maintains vascular health. Now, we can't
Very important one.
measure nitric oxide, but we can measure a surrogate marker, ADMA. So there
Mhm.
are different markers that we can look at in women with PCOS that will give us a clue. Women with PCOS tend to have leaky gut,
Mhm.
impaired gut barrier, and that causes a lot of the gut contents, the microbes and other toxins, we call them LPS, lipopolysaccharides or endotoxins, to come between the cells of the lining of the gut into the body itself, and causes the immune cells that are embedded in that, what we call the GALT, the gut-associated lymphoid tissue, where a big percentage of the immune system lies around the gut, to create an inflammatory response, in effect, as a response to the leaking of these toxins coming into the body. And you get inflammatory cytokines being produced, which can also be, some of them can be measured, and you can look at the surrogate marker, high sensitivity C-reactive protein, which is the
CRP.
liver's response to high levels of circulating inflammatory cytokines. So
Mhm.
we can measure this inflammatory response. And because there's so much inflammation, that triggers insulin resistance.
Resistance. Yep. No,
I
for
know.
sure.
So isn't that something?
Yeah, it's a huge formula. Our body is one intricate machine, isn't it?
Absolutely. So women with PCOS typically have significant insulin resistance, and their development of diabetes is 7 times higher by age 40 than the average population of women.
Mhm.
So we, of course, can use lab testing to measure, looking at insulin levels, blood sugar levels. You can do, um, glucose tolerance tests as well when necessary. The bottom line is that women with PCOS have systemic low level inflammation, insulin resistance, low levels of nitric oxide, and vascular dysfunction. And because estradiol is key to the production of the neurotransmitter acetylcholine, which is the main neurotransmitter of the vagus nerve, which is key to functional health of the autonomic nervous system, which controls everything we don't think about, like our pulse, our temperature, if we're sweating, like if we're tearing in our eyes when our saliva comes out, like all the things, like when our bladder wants to empty, like the things we never think about. And you don't have, when you have PCOS, you don't have proper function of your autonomic nervous system. The vagus nerve is what's important for parasympathetic function, which is what should be the normal baseline, sometimes called rest and digest, so that your gut has normal motility, you're in a calm state. And so women with PCOS tend to be more in a stressed state, which is
Hmm.
called the sympathetic. And that causes like more what we call adrenergic. That's part of the stress response. So they put out more cortisol, which then causes more leaky gut, more stress, more insulin resistance. So you can snowball, exactly a snowball effect. But we can measure all of these things with lab testing so that we know. I always say you can never monitor what you never measure.
Exactly.
So
No,
we can
very.
know all these things. And the thing that is so like unbelievable really is that these women, many of them are in their 20s, their 30s, they're so young at the time of their life when they should be most fertile, just be getting their careers and their families going. And here they are having irregular cycles, infertility, when they do get pregnant, high rates of pregnancy complications, and they have all these metabolic problems. And because they have dysfunction of their mitochondria and their adipose or their fat tissue, severely overweight and obese, because it's a different skill set, once again, to burn fat than to create fat. And when you have insulin resistance, which is pretty much universal in women with
Yeah.
PCOS, you have high levels of insulin all the time. And insulin, which is vital to survival. If you don't have insulin, you will die. That it's not like it's optional. But once again, it's like too much of a good thing is a bad thing. We need
Right.
insulin, but too much, you then have problems because insulin is the hormone that promotes the production and storage of fat. So women with PCOS do not have the proper mitochondrial function, which is how you burn fat, and
Hmm.
they have too much insulin, which causes too much production and storage of fat. So they have a lot of weight loss resistance. It's really hard for them to lose weight.
Hmm.
So, it's like insult to injury, acne, facial hair
Right.
thinning, obesity, and all these metabolic problems and reproductive problems. And it seems overwhelming. But the first step, I always say, in solving a problem is to understand the problem. So
Exactly.
by doing
Right.
proper lab testing and seeing, okay, well, how is your inflammation? And then
Mhm.
because you have so much leaky gut, impaired gut barrier function, you're going to have alteration of digestive processes. So often you'll have nutrient insufficiencies, like,
Yeah.
vital things like iron could be low. You could have low B12, omega 3, any vitamin or every vitamin can be low. And women with PCOS, because of leaky gut, that creates like a chronic infection because you have bacteria coming in continuously. That can actually predispose to autoimmunity. Women with PCOS have high rates of Hashimoto's thyroiditis, autoimmune thyroid disease, because the antibodies that are created by our immune systems that are against the bacteria leaking into the body can cross react with our own tissue. It's called molecular mimicry. It's like mistaken identity. There's
Mhm.
similarities in the nuclear structure of thyroid and other tissues to the bacteria that are leaking from our gut. And the immune system, like mistaken identity, makes antibodies to ourselves as well as to the bacteria. And so we have to test for autoimmune. We have to test the antibodies involved in hypothyroidism. And of course, we have to test for hypothyroidism. So low thyroid and Hashimoto's are really common in women with PCOS, multiple times higher.
Mhm.
So estradiol regulates the immune system because there's every immune cell has an estrogen receptor on it. And one of the important types of immune cells are called T regulatory cells. They help in a variety of ways, including preventing autoimmunity by helping us to recognize ourselves from other alien tissues and antigens, other types of
Exactly,
proteins.
exactly.
And women
So
with PCOS have low levels of T regulatory cells. So you can see it's a big complicated mess,
A
but
bit complicated. My
I
goodness.
know,
This
but
is
there
like
are
an
things that
encyclopedia right here. I love it.
there are because that's why I call PCOS the signature condition of
Mhm.
metabolic dysfunction. If you can master PCOS, you can master any metabolic condition that the body can face
Oh, it's
because
like the
and then you
Super Bowl
can
disease women, it seems. I
yes,
mean, like,
and you
it's
can
the big time
master
one.
but the good news is that there are things we can do. It's not like, "Oh, it's hopeless, give up," and throw in the towel and go in the corner and just give up. Not at all. By testing and understanding each of these things, we can work to help restore the gut microbiome and gut integrity. I prescribe instead of birth control pills, which are like fake hormones for
Yeah.
humans. You can give bioidentical hormones. So you can give, estradiol's too low. We can give back estradiol. We can measure levels. We can give bioidentical progesterone. And bioidentical progesterone is anti-inflammatory. It also downregulates the testosterone receptors, and then of course, so we can do all of these testing and then we can actually come up with therapeutic approaches. And once again, we have to rule out the other conditions that can mimic PCOS, which
Mhm.
include adrenal tumors, acquired or late onset adrenal hyperplasia, basically issues that are involving the adrenal gland. So if you think, well, where do androgens in the like male type hormones in the female body come from?
Ovaries and
25%.
adrenals.
Yeah, so 25% of testosterone comes from the ovaries in a normal woman, but
Mhm.
where does the other 75% come from? From androgen precursors to testosterone, which
Mhm.
are mostly coming from the adrenal gland, and 25% of actual produced testosterone comes from the adrenal gland. So,
Mhm.
we have to think adrenal function, and then you can have Cushing's disease and Cushing's syndrome, where you can have elevated hormones from the pituitary, adrenocorticotropin hormone,
CH.
ACTH, totally measurable. You can have elevated cortisol. We can check 24-hour urine cortisols. I mean, a lot of this may go through an endocrinologist if you don't have the background, but at
Background,
least
yeah.
but somebody who has the knowledge will be doing this testing because then you can rule out, Cushing syndrome, adrenal tumors. You can also rule out special tumors
Mhm.
from the ovary too that can produce excessive, like huge amounts, like male levels of testosterone.
Mhm.
And
No, for sure.
the hormone prolactin, which is made by the pituitary gland, if you have high levels of prolactin, it affects the adrenal gland. It may block one of the enzyme systems, and then you end up going down the pathway and you make more DHEAS and then
Mhm.
more testosterone from the adrenal. So you have to measure prolactin, and high levels of prolactin will interfere with the menstrual cycle, and you may have no cycle or you may have irregular cycles. So, you have to measure prolactin, you have to measure cortisol, you have to measure sometimes 24-hour, you maybe want to get 4-point cortisol, you're going to measure DHEAS. That's really important. 100% of circulating DHEAS, dihydroepiandrosterone sulfate, 100% of
Mouthful.
it, 100% comes from the adrenal gland. So if you have high DHEAS, it's adrenal origin.
Mhm.
And, of course, some of it, usually if you have high DHEAS, you're also gonna have some degree of high testosterone coming as
For
well
sure.
from the adrenal. So, you have to go through this workup or else
Mhm.
you're going to miss serious things like, like all these other adrenal related problems
That
and
it could be.
prolactin related
Do
problems.
do you
So
test
lab
DHT?
testing is critical.
Are you testing things like, free testosterone versus testosterone or DHT and things like that, that are gonna be more strong on the overall androgen spectrum or no?
I usually do measure free testosterone. I also measure sex hormone binding globulin. I'm glad you
SHBG, yeah.
brought that up. So, sex hormone binding globulin is really important to measure. When you have high levels of insulin and high levels of testosterone, it will often suppress the
Mhm.
production from the liver of sex hormone binding globulin. And testosterone is 99% bound like in the blood, mostly to sex hormone binding globulin, which holds it tight like super glue, and then some to albumin, which is a little bit looser. But when you have really low sex hormone binding globulin, it means you'll have more unbound or free
Exactly.
testosterone, free to do what? To act on the receptors in
More directly.
like the skin and elsewhere, and then you'll have more of the androgen excess, acne, hair loss, facial hair and all of that. And the
Hmm.
total testosterone may be mildly elevated, but because you have such a low sex hormone binding globulin, the unbound testosterone or free is like really excessively high. So by
Yeah.
looking at all these measures, now I typically don't measure dihydrotestosterone only because it's a paracrine created hormone. That means it's made in the tissues itself and only a tiny bit will actually circulate. Most of it is made
Hmm.
in like the skin and it stays in the skin. So, but the reality is that when you have inflammation, unfortunately, and women with PCOS have a lot of inflammation, it upregulates the enzyme 5-alpha reductase,
I know
which is
circus,
the
yeah.
enzyme that converts testosterone into the more potent form,
Hmm.
dihydrotestosterone. So we know by measuring inflammation markers that they definitely will have more of the DHT because they are going to upregulate that enzyme. So we can know it
Yeah.
indirectly.
Super, super important fact there when it comes to inflammation. And again, like I tell everybody, I have one of the most in-depth blood tests you'll possibly find that I actually use through Access. It's great. And I tell everybody the only thing I'm really looking for is either stress or inflammation in the system. Because if you can go after that, you're kind of diagnosing upstream. So if you had to sit there and say, some of the top three things that you think might be stimulating somebody to have PCOS, or could it be like heavy metal toxicities when they're younger, or could it be things like hidden infections like Candida, EBV, CMV, things like that, that stimulate the cascade of inflammation that could then lead to PCOS or whatever they're planning on calling here in the next couple years.
Right.
So if you had to theorize, again, I'm not going to hold you to it. Do you think there's a causative agent for PCOS, or do you think it's something genetic, or is it something that we're eating, or the high stress lifestyles, or poor sleep? What would you think is kind of the number one stimulating aspect of PCOS, and it's so rampant today?
Well, all the things you mentioned are contributors. So it starts with genetics. We know that if you have someone has PCOS, there's a 50%, not 100%, 50% chance that they will have a first degree relative or a second degree relative with PCOS. That would be like your mom, your sister, your aunt, your grandma, had PCOS as well. So there's a genetic component, but it's so different now than it was, say, a few hundred years ago. In fact, we think that the ancient form of PCOS was probably a selection advantage for women because they were just slightly making too much testosterone, but just slightly because
Yeah,
of
it's better to handle.
some defect, with the FSH and the enzyme aromatase, but it was very slight. So they had a slight built-in contraception so that they would be less likely to die in childbirth or have too many kids they couldn't take care of. So they had this slight, if they weren't sterile, they were just
Mhm.
slightly less fertile, but just slight. They also had a little bit extra testosterone that made them braver, bolder, more dynamic. In fact, they were probably the leaders of their tribe. They were like the star women. And in fact, when
Exactly.
they tested testosterone, endogenous testosterone, in Olympic gold medalist winners who are women, they have
Mhm.
a slight higher level of natural testosterone. So they're stronger, they're bolder, they're like
Faster,
more
right? Exactly.
dedicated, they're braver. So it used to be like a real plus. And I like to emphasize that with my patients. Like you come from the best genetic background, but modern society has turned against you. So it starts with in utero exposures to endocrine disruptors. Now, they could
Exactly.
be metalloestrogens, like we know chromium,
Hmm.
mercury. They actually are endocrine disruptors for estrogen. So, heavy
Mercury's
metals
huge.
can be a component. There's been the most research on the bisphenols, BPA, bisphenol
Mhm.
A, has is very high levels concentrate in the fetus more than in the mother. So this is ubiquitous. Everyone is now being exposed to BPA. And it comes and it goes quickly, but it keeps coming back. That's the problem. So, and it concentrates in the fetus, and it's a massive endocrine disruptor for estrogen, but also for melatonin, for testosterone. It's just terrible. And then we have phthalates. These are like in soft plastics and so-called fragrance, scents, and things like that. And they're also in a lot of personal care products, and these get into the fetus as well. And then, of course, there's in childhood and during critical, like pubertal times of life. And
Exactly.
so it's all the endocrine disruptors. And then not only do we have the plastics and the heavy metals, but we have, flame retardants, PCBs. I mean, it's like
Sure.
endless, these endocrine disruptors. And then like light, like you mentioned, like light. So we live in a world now where we have circadian rhythm dysfunction because we have
Yeah.
too much light exposure at night. And this suppresses melatonin and keeps our cortisol too high. And we know that there's melatonin problems in women with PCOS. That's how it gets even more complicated. And of course, our sedentary lifestyles, and then the unfortunate ultra processed food. So it's what we eat and what we don't eat. The ultra processed food with all the chemicals and
Mhm.
the nutrient depleters and the lack of adequate fiber, natural fibers, and that nourish the gut microbiome, contribute to damaging our gut microbiome and at very young ages. And also then you get leaky gut, which then creates more inflammation, et cetera, like we talked about. So the diet has changed. In fact, changing to a plant focused diet with lots of natural fibers, lots of diverse polyphenols, the antioxidants and the minerals, the vitamins can make a world of difference for women with PCOS. And
No, for
then
sure.
and then we have this chronic stress that you mentioned, like people are put into situations where they just feel stressed all the time, emotionally stressed and physically stressed, from lack of adequate sleep. And then just like in school, they may feel stressed, they may be bullied, so there's all kinds of things that can create chronic levels of stress, which then create, a cascade of health
That's good.
problems. So it's like the multitude of, toxic environment, toxic food, inadequate exercise, inadequate sleep, too much light, and it's all come together in this perfect storm that takes women who have a propensity to not make enough estradiol properly and just put them over the edge. So it's really something that understanding the cause really helps to put it in perspective, and
For sure.
understanding that the basic foundations of women with PCOS are not damaged. They're not damaged people. They
Right.
actually have a big plus going for them of the little bit extra testosterone. It's just blown into this exorbitant overproduction. And this is treatable, and understanding that we can measure so many of these things. I measure heavy metals. I'm glad you brought that up. I measure
I was
heavy
gonna
metals
ask you about
when
that, testing heavy metals and EBV and all that stuff with that, yeah. Most
absolutely.
important thing.
I love data. I love data. So it's like
You and me
not
both.
dangerous. Yeah, I love how are you gonna know what's going on if you don't collect data?
Precision
So
medicine, that's the future,
it's
a lot of
personalized.
physicians just dump estrogen on it and just keep dumping, dumping, dumping. It's just like, no, it's a mercury toxicity. It's a chronic EBV reactivation. It's a candida infection. There's a million
Yes.
different things that are
Oh
stimulated in
my
stress.
gosh. Especially since COVID, I measure so
Oh, yeah.
much Epstein-Barr virus for reactivation.
It's crazy. Like,
Absolutely. But
CMV, the amount of reactivated CMV I'm seeing right now it's mind-blowing.
yes, absolutely. And we know that women have this more, like I talked about, more robust immune system, and chronic infections underlie, which leaky gut is a chronic infection, but so is chronic Epstein-Barr, so is chronic COVID. Chronic infections underlie autoimmune diseases, so it's like a double whammy. You have a chronic infection, plus you increase the risk of autoimmunity. And we know that women make up 80% of people who suffer from autoimmunity. So
Yeah,
these are like really major things to look at. And I test ANA. Oh my gosh, I test an anti-nuclear
oh, yeah.
antibody on everyone. And
You do a panel.
yeah, and positive doesn't mean ignore it and wait
No,
to see if you get a full-blown disease.
sweep it
But
under the rug. Yeah, forget that positive, but that's who
you
cares?
know, that's what rheumatologists do.
Of
Like
course
all the
they
I mean,
do. I
I
mean,
love them.
they
That's
they just look for insurance and figure it out,
You know, if they'll say, "Come back when you have really severe symptoms." But that's not our approach in functional
No,
medicine.
no,
We
no.
wanna be proactive by repairing leaky gut, by
Mhm.
looking for chronic infections, by
Of course.
repairing lifestyle issues, so that you can reverse early stage disease, like early diabetes. It's reversible. Late stage disease, end stage disease, you can do something good, but you're not going to reverse end stage heart failure, end stage renal failure. Just that's not possible. End stage osteoporosis, you're going to fix those bones when they're like paper thin, but we
You
are
got it.
not about letting things get to that stage. You want to
Preventative is
intervene
so much easier to fix than
early.
than actual curative, And, it's always one of those situations where when you take a look at medicine from a 30,000-foot view, I always like to say, you see a lot more of the actual person. And then when it comes to a treatment process, which is what you do, and I was nerding out on your page, before this. I love to see that it's more of a, like you said, an integrative functional approach to it, to where we aren't just looking at cysts on the ovaries. You know what I mean? Like those are most likely just a byproduct of everything. It's the stress you're going through. I would love to see the correlation between smartphones and the increase in PCOS. You know what I mean? Like just the amount of stress that a smartphone has, plus the light and the calcification of the pineal gland before bed. So bad sleep, no delta sleep. I mean, you can go
Yeah.
down such a rabbit hole on this one. So it seems like what I think we're both coming to the actual conclusion of is that stressful lifestyles are probably one of the biggest factors that factor into what actual PCOS is, as well as the actual propagations of its symptoms.
Absolutely. I actually have published papers in medical journals on exactly that topic on
No way. You have
PCOS.
to send
Oh,
them to
yeah.
me.
Yeah, sure. And it is definitely exacerbation by modern lifestyle problems, we can say, the
Mhm.
problem. And
Yeah,
it is a big problem because it is interfering with the quality of life of such a large number of women. I mean,
sure.
it's heartbreaking when you see that, and also, it's heartbreaking that patients are not often diagnosed correctly and they're treated in a very non-lifestyle form. It's like they're, and even
Factory
I'm
load.
not against drugs at all, but the solution is never a drug by itself. So even if they go on GLP-1 receptor agonists, which are so popular now,
Mhm.
you can't just do that alone because if you ignore the diet, they're going to lose a lot of muscle. If you
Of
don't do
course.
fitness, exercise, they're going to lose a lot of muscle. And muscle is what burns glucose and fat.
Metabolic.
Yeah,
Exactly.
if you lose a lot of your muscle, and you can lose a lot, you will then get much higher risk of diabetes. It's like the antithesis of what you want is to lose muscle, especially in someone who's already in a situation of severe insulin resistance, and they need to have muscle to burn. They need functional muscle. So, I have so many worries about these drugs. I understand the pluses, but I also know the minuses, but they, even when they're used, they can't be used in a vacuum. And that's
No,
often what's happening. You have to test, you have to measure, you have to monitor all of these things to see what's happening and to make sure that you're actually not doing more harm than good for the long haul, for
exactly. And I
for for
I think
life.
I think a lot of physicians can't correlate that. The more lab testing, the more you treat, not only does obviously better for the practice and the business aspect of it, but for the actual efficacy of what you're actually delivering. And I've been seeing just in this industry. I mean, I've been here 15 years. You've been here longer. Just to sit there and see that now you see this huge rush into the anti-aging industry or the wellness industry or whatever you want to classify this whole
Yeah, it keeps
movement
changing
as.
lanes. Yeah.
Yeah, it's very malleable. But you're seeing a lot of physicians jump into it who are just sitting there saying low testosterone, you give them testosterone, that's it. They're not thinking about negative feedback loops. They're not thinking about what that can convert into, what that does to the overall immune system, this, that, and the other. So it's getting kind of scary to see how many people are just jumping into this and just being like, oh, testosterone's low, give them this, estrogen's low, give them this, when they aren't, thinking 5, 6 steps down the process, as well as why that hormone might be off or that biomarker might be off. So it's a breath of fresh air to speak to
Absolutely.
a fellow physician who kind of sits there and I think gets it. I think precision medicine is the true form of it. Traditional medicine's broken. The third leading cause of death in the United States is medical error. You know what I mean? Whereas now the whole wellness industry is starting to get to that point where it's just becoming gimmicky and buy
I
cranberry
know.
juice, cure this. You know?
Well, I can't agree with you more. I talk about this, like, if you talk about men and testosterone, if they have high levels of inflammation, which hasn't been measured or addressed, they're going to have inflammation. I remember inflammation upregulates the enzyme, I mentioned 5-alpha reductase. Yes,
Mhm.
that's why men who tend to have balding and a lot of body hair tend to have higher rates of heart disease. And like this, because it's partially a reflection of genetics, but it's also a reflection of inflammation. But it also, inflammation upregulates the enzyme aromatase. So when you
Mhm.
give the men the testosterone, they're going to convert more of it into estrogen, which for a man, you don't want all that estrogen.
No, you
Estrogen is
don't.
really important, but you don't, like, everything has a sweet spot. You don't wanna have
Exactly.
high
Yeah,
level.
too much
That's
of a
how
thing is a
men
bad
get
thing.
that's how men get so-called man boobs, right? We don't
Uh-huh.
want that, you know? And
Oh, very
prostate
true.
hypertrophy, you want enlarged prostate? That's the prostate is the analogous gland to the uterus, and if you have too much inflammation, it converts the testosterone into estrogens, and the estrogens create a lot of growth factors, and growth
Mm.
factors that are uncontrolled leads to uncontrolled growth, and you get growing prostate, you know?
It's in the
So you
name,
gotta
right?
you can't just throw testosterone in an absence of lifestyle changes and
Exactly.
monitoring and measuring. So, that's it's and yes, you're right that there are many that are going into this anti-aging field or whatever, longevity, you can name they have some wellness, and they're
Yeah.
not looking at the total picture. And so you have to measure, you have to monitor, and you have to understand what is
Exactly.
happening. That's the
Diagnose,
whole
diagnose,
principle.
diagnose. Well, I gotta say,
Absolutely.
this has been a very, very fun podcast. I've learned a lot, which is tough for me to sit there and actually wrap my head around it. But I must say, everything that I've read on the internet about you is 100% genuine. You are a master of what you do. So I really can't thank you enough for stopping by. I always like to, with all my guests, I like to ask two questions, and I say, give me the elevator pitch for both. Number one, for a physician looking to get into the wellness, anti-aging, regenerative, integrative field, what is your biggest piece of advice?
Well, my biggest piece of advice is to start with lifestyle. Okay. Understanding what you can do from a lifestyle approach. Everything else will come in turn. But
Mhm.
foundational, I always say, if you're going to have 1,000-piece puzzle, the 600, you always start with the rim, right? You always start with the frame, right, Ed? So the 600 surrounding pieces of this 1,000-piece puzzle are lifestyle. And then the center is pharmaceuticals and hormones and these other things. But you got to start with the outside. So master lifestyle medicine issues and
I
then
love
take courses in functional medicine, which
that.
should be just called medicine. Because if
Yeah.
you don't know if you
Yes.
don't get a basic idea of cell processes, of
Mhm.
pathways, of interactions between organ systems and so on, like just foundational, how do mitochondria work and
Mhm.
the basics of cellular processes and pathways and enzymes, then you will just be a pawn of big pharma, just like
Exactly.
this
Robot.
symptom, this symptom, this drug, this symptom. Really want to be personalizing and precision medicine practicing, then you got to try to really master functional medicine, how the body works, getting down to the cellular level and then building up from there. So the most important things is master the foundations of lifestyle medicine, which of course are avoidance of toxicities,
Mhm.
nutrition, everything about
Sleep,
nutrition,
everything.
fitness, sleep, stress management, right? Those would be
Exactly.
like the cornerstone.
You and me are two in the same, sister.
All
That's
right,
actually
all
why
right.
I actually named my practice lifestyle medicine 15 years ago before anybody really talked about it.
Yep,
But it's
agree.
funny you say that, the whole puzzle aspect, and I always say, because I kind of use a similar analogy, and I say the diagnostic aspect is the actual picture that you're looking at when you're building the puzzle. So if
All
you don't have
right.
the correct picture, which is diagnostics, and I say over test, you know what I mean, like the amount of weird things like arsenic toxicities, MCTD, all kinds of weird things that we find can explain somebody's chronic conditions they've had for 10, 20, 30 years. So just having that picture to kind of put your puzzle together is one of the most important parts of what
Oh, you
precision
know,
medicine is.
I'm glad you mentioned, just as a lab test that I didn't mention, is that women with PCOS have higher rates of methylation dysfunction.
Okay,
So,
yeah, no, for sure.
like testing like MTHFR, that enzyme,
Hmm.
it can be helpful because many times they really need excessive, compared to average persons, methylated folate and
Folate.
B12. because they don't make the conversion into the methylation pathways very well. So, you just have to look at all these things, right? From,
The whole
and
piece of the pie,
the
right?
whole piece. And I love that we think of medicine and human health from a puzzle that you put together, that you solve, and it's what makes it fun, challenging,
Exactly.
but
I mean, it
always
makes it
fun
real.
and
Yep.
rewarding when you get the
Heck
puzzle
yeah.
together.
All right, the second question, and then I'm going to let you go because I know you've had a busy day. Is if you were going to speak to a patient who's coming from traditional medicine and exploring this field right now, what's the most important thing that they should be looking for when looking for a physician or a practice or a place to kind of get their feet wet with integrative medicine?
Well, if you can, see what the background education and training is of the practitioner that you're going to see if they've done fellowship training at one of the universities, like UCI has a fellowship in integrative medicine, University of Arizona has a fellowship that can lead to an actual board certification criteria, like a legitimate board, just like the board of family medicine, ER medicine, it's a real board, or if they've done one of the functional medicine courses. I mean, if all they have to their credentials, I do believe somewhat in credentials. If all they have is, they took a weekend course somewhere with a nutraceutical company, I don't think that's quite adequate. So see if they have been doing it for a few years,
Hmm.
and check reviews maybe, although I hate the idea of Yelp reviews, but,
Yeah.
sometimes they can be a little helpful. And, if you have a friend who has done well, there's nothing like success to breed like attraction, right? Like, I
Of
like
course.
that person's outcome. There's nothing more
Word of
flattering
mouth.
than the word of mouth. Exactly.
Best form of it
But,
right there.
be careful about just going by social media,
Yeah.
because
Social media is dangerous.
anybody can say anything anytime. And, you have to look at, like, I've talked to patients and I say, well, what is the education of the person that you've been seeing? And they actually don't know. So, like, you could be, I'm not saying they're bad, they're just different, like a lifestyle coach, or you could be a chiropractor, or you could be a naturopath, or you could be a medical doctor, you could be a nurse practitioner. You should at least know, like, what was the fundamental foundational education of the person that is treating you. And it's
Very
amazing how
true.
people don't know. Like, well,
Oh,
I don't
they
know.
see
It's like,
followers and likes and they lose their mind, you know what I mean? Like, they don't understand you
yeah,
can buy those, you know what I mean? Like, just because a celebrity
that's
said
right.
something that absolutely nothing, you know what I
Right.
mean?
So
Like,
do due
it's always good to
diligence
make sure.
as best you
I love
can, and then if it feels wrong, change.
there we go. Oh, I love that. That's we're going to end on that one because that was too perfect. Well, Dr. Gersh, I have to say thank you so much. It's been religion almost when it comes to female hormones here. So I really, really appreciate it. Thank you for being on the Lifestyle Medicine podcast. And is there anything you'd like to say in closing?
Well, I'm a practicing brick and mortar office person. So I'm actually in my office. I have an exam table right over there. This is a converted
There it is.
exam room. So, I'm still a practicing, brick and mortar, in the trenches doctor. So if you're looking for actual doctoring, I'm still one of them. I'm not like just on social media. I actually see
Oh, I hear
patients
you. I love
all day
that.
long. That's why I kept you waiting. I was seeing a real patient.
Which I had no problem doing, darling. Well, thank you so much again. It's been amazing. I can't wait to, actually watch this again and, get my pen and paper out and actually take some notes from you.
My pleasure.
All right. You have a great day. Okay. Bye-bye.
Thanks for joining us today on the Lifestyle Medicine Podcast. At Access Labs, every innovation we pursue is driven by one bold purpose: making personalized medicine more practical and accessible for patients and providers. If this episode sparked new ideas or challenged how you think about patient care, awesome. Follow the show and share it with a colleague who's ready to level up their practice. Head over to our website at accesslabs.com and register your practitioner account today. You'll get access to over 1,000 routine and advanced biomarkers with 24-hour results. When signing up, select Lifestyle Medicine Podcast as how you heard about us and score 10% off your first invoice. Oh, and don't forget, drop us a review. It helps more practitioners like you find us. We'll see you next time.